Hello, I'm Ji-dae Kyung, Director of Seoul May Dental Clinic. Today is the 8th session with me, Part 2 of the treatment strategy for Class 1 malocclusion. I talked about curve of Spee in Part 1. I believe that you can follow up on the Part 1 lesson. In Part 2, I will focus on considerations by condition. I can cover broad topics in more detail. But for today, I will give more explanation about transverse discrepancy, for which I can share more ideas and tips with you. Under the topic of transverse discrepancy, I included an anterior crossbite as well because we cannot set aside a whole session for that. I will briefly mention that, instead of skeletal class 3, this will be more about anterior crossbite from the functional perspective. Basically, clear aligner will be more appropriate. Because in the case of bracket-based treatment, you sometimes have to raise the posterior bite block to address the issue. But in aligner treatment, bite raising will naturally come with aligners. And these days, wearing time of each aligner seems to have been reduced to about a week. Of course, from a biophysical point of view, there can be many opinions about which way is more right, 2 weeks or 1 week. But 1 week of wearing should be fine. In particular, in addressing a crossbite, TFO and others might happen. So, I personally let patients wear aligners for 5 days or 7 days. I think I can explain this again later, while checking the photos together. Here is the case of an anterior crossbite. It is a class 1 crowding case. Here you can see some abrasion. Through IPR, we can easily induce forward angulation on the maxillary anterior region. Here, like this, right? The issue has been solved with IPR and some expansion by using 24 aligners over 8 months. As you saw earlier, 24 steps of aligners were used over 8 months. Next is the second case of a crossbite. Here, you can see that tooth number 22 is locked in between adjacent teeth. Due to the repetitive chewing activity, some wearing away of a tooth can happen. I briefly mentioned this in the third and fourth points on the previous slide. When you induce labioversion on the tooth locked inside on the anterior region, what did I say inevitably happen? Tipping intrusion will follow. So for more extrusion, we may need to induce extrusion intentionally by using an attachment for that purpose. On a closer look, you can see that we can additionally attach this type of attachment to induce extrusion. Actually, for a transverse issue alone, I can spend 5 or 6 hours if possible. There are good books you can refer to, such as the one written by Professor Lee Ki-jun. I am sure that you can find it very helpful. But for today's session, I want to talk more about specific cases such as a crossbite, scissors bite, or things that you can easily handle with cross elastics, by which I mean cases without vertical issues. They have more to do with dental factors. Usually we induce angulation in the process of transverse expansion during tooth movements. In aligner treatment, moment will be generated by attachments like this. And with that, a bodily movement will be intended. Of course, this won't be easy. However, with improvements in aligner material and attachment precision, I believe that it will be much easier. Anyway, we will create space with this transverse expansion to solve the issue of crowding. Due to the shape of an aligner, which looks like a horseshoe, it has some characteristics. towards the posterior region, the extent of expansion will decrease. This is a case of addressing crowding only through expansion and IPR. We planned and ensured some extent of expansion with 41 steps of aligners. Aligner manufacturers, including Magic Align, usually use the grid paper to display the initial status, the results, and the comparison between the plan and actual change. By measuring the length in the transverse expansion, we can do the comparison and factor in some elements in the planning. Like this, in the case of an extreme scissors bite or a crossbite, you can use cross elastics. I'm sure you are familiar with it. Usually 3/16 inch of cross elastics weighing 4 or 4.5 ounces will be used. Another case we can encounter is a case of posterior crowding. Sometimes a second molar has buccal eversion and is rotated mesially toward the front. We can handle such case with IPR if it is not extreme or molar distalization if it is extreme. I think it is important for you to take note of this. When checking tooth number 17, in terms of a bite with the lower jaw, it is a scissors bite. So, when looking at the occlusal plane, you can see that it has been rotated a bit towards the mesial side. If you intend to go ahead right away in this case, what did I say is important to address crowding? Space. That's what matters. Same in the posterior region. IPR only will not be enough space-wise. So, this is the web viewer treatment planning video clip that you will receive in the beginning. Here, you can see a scissors bite. Posterior crowding is too severe to be solved only with IPR. In this case, you can create space through molar distalization and use cross elastics to address the scissors bite. Like this, after molar distalization, you can put cross elastics to adjust the bite. A scissors bite in the posterior region. This is the case you just saw. I was able to produce a stable occlusion like this after going through 48 steps of aligners over 15 months. Now, let's take a look at the second case. This is a Class 1 crowding case, which does not seem too much difficult. If you look here closely, you can just think that a little bit of interdigitation adjustment will suffice. Then, let's check the web viewer. There can be some distortions on the photos, so it would be better to check the web viewer. This is a video clip about planning you will get in the beginning. We are going to see the diagnosis here. At first glance, you might think that a little bit of uprighting will be enough. But it turned out that there was a big overjet. What do you think? You can see here that the extent of buccal overjet is quite severe. So, instead of dealing with individual teeth, I applied lingual buttons on number 25, 26, 35, 36, and 37, and put cross elastics over them to adjust the buccal overjet. So over 10 months, we used 37 steps of aligners to adjust interdigitation, thereby solving the issue of crowding and buccal overjet. Back to the previous case. If you look here, we used extrusion attachment to take out this tooth stuck in between. Now, the last one. When trying to address the transverse discrepancy, let's say the extent is too severe or it has to do with skeletal issues. Of course, this single case cannot be the answer. Anyway, this is a surgery patient. You can see that it is very narrow transverse-wise. In a case like this, you can use MARPI along with aligners for an adult patient, thereby expanding the mid-palatal suture. This tactic using these tools can also be very useful. That is the tip I want to share with you. How did you find today's session? Over 2 sessions, I talked about how to treat Class 1 malocclusion. Since it is quite a broad topic, 2 sessions can be insufficient. But still, I hope that you can find the sessions helpful. I'll be back with the next session. Thank you for watching.